In this video, this is the second part of a two-part series. We've already laid out and drawn out our anatomy, and this is a cross-section of the lower leg, and it's about the middle third of the lower leg so that we're appreciating the muscle bellies of these different compartments of the lower leg. Again, this is the left leg. It's as if we're looking down towards our toes. And just to orient, again, these markers aren't perfect, I apologize, but this is going to be the tibia. This is the outline of that lower leg. Tibia, interosseous membrane, fibula, and then this is going to be my anterior compartment muscles, my lateral compartment, and my posterior compartment. So as we talk about dry needling these different muscles, we want to take into consideration our precautions. So we're going to avoid these neurovascular bundles here, the deep peroneal nerve in the anterior compartment with the anterior tibial artery and vein, and then the tibial nerve, again, with the posterior tibial artery and vein. So as I think about starting to needle the muscles in this anterior compartment, knowing these orientations are going to give me a sense for what the trajectory of my needles are going to be. So for anterior tibialis, the trajectory of my needle, so that I can avoid aiming for that neurovascular structure, I don't want to go directly anterior to posterior. I want to go slightly laterally to medial and aim for that tibia. So that's going to be my needle direction. Okay. So for the anterior tibialis, my needle is going to be directed towards the tibia. For my extensor hallucis longus, which is going to be next to that anterior tibia, I'm going to have to kind of scoot the anterior tibialis muscle out of the way. But again, my angle is going to be back towards the tibia. So I don't just want to go directly anterior to posterior. So I'm going to angle this way back towards the tibia on that lateral side of the lower leg. Okay, so I'm avoiding that neurovascular structure. Tibia is going to be my backdrop. For extensor digitorum longus, because it's so far lateral, I'm not going to aim this way. What I'm going to do is I'm going to aim towards the fibula as my backdrop. This is going to be a pure anterior to posterior direction because I'm now lateral to those neurovascular structures, and I can use the fibula as my backdrop. So my needle direction is going to be there, straight anterior to posterior. Okay, so that's the anterior compartment. If I move into the lateral compartment, the muscle that we're primarily going to target is the peroneus longus, which is that outer muscle. And again, I'm aiming for the fibula as my backdrop. So my needle is going to go in a pure lateral to medial direction. And I'm probably going to get brevis depending on where I am along that lower leg. But mainly we're going for the bigger muscle bulk longus. Peroneus brevis is going to be farther distal in the leg, so you can kind of think about that where you are in that lower leg. But that's going to be my lateral compartment, the main muscle that we're going to needle. As I move into the posterior compartment, I can think about which structures I'm trying to avoid, mainly this tibial nerve. And so as I needle these more superficial layers, what you really want to think about doing is needling away from midline. So we're not going to go purely P to A, but what we're going to do, so we're not going to do that. What we're going to do is we're going to angle slightly towards the outside of the muscle bulk or muscle group for the gastrocnemius in this kind of Christmas tree trajectory. So for lateral gastroc, I can needle this way, and for medial gastroc, I can needle this way. Okay. For soleus, what we want to do, again, if I needle this way, I'm running into, if I get to the midline, that tibial nerve. I'm also getting gastroc. If I just want to isolate soleus, I'm actually going to go deep to gastroc, and I'm going to come in a medial to lateral direction. So that would be my needle insertion to get soleus. Similar to soleus, I'm just going to show you this muscle next because I think it makes sense as far as the needle trajectory. If I'm coming medial to lateral, so that's kind of the middle layer soleus. If I go to this deep layer, then I can target the posterior tibialis and try to skim along the posterior aspect of that tibia bone. So this would be my needle trajectory for the posterior tibialis muscle. If I'm trying to aim for the flexor digitorum longus, which is still posterior tibia, instead of going right alongside in this medial to lateral direction, what I'm going to try to do on the medial border is I'm going to snug away these outer muscles. I'm going to kind of pull them this way towards the back of the calf, and I'm going to get right in between that tibia. You can feel that ridge of that tibia and those more superficial muscles, but I'm going to angle towards the posterior tibia. So the flexor digitorum longus, I'm going to needle in that general direction. If I come back to this lateral side and notice that on the anterior compartment we needled extensor digitorum longus in an AP direction, flexor hallucis longus is going to be the complementary muscle in the posterior compartment. So I'm going to needle that with the fibula as a backdrop in a purely posterior to anterior direction. So it's going to come just like that to get that part of the flexor hallucis longus. And the backdrop here, again, is going to be your fibula. Okay? So I hope that helps as you're thinking about where you're needling these muscles to have a sense of the 3D anatomy and cross-section and the way those needles are going to travel to avoid these key neurovascular structures, but also get at the muscle that you want to get at.